If amlodipine is in your pill organizer right now, there are 5 very specific things you should be careful with, and at least one of them is probably part of your routine already. Not because anyone is trying to hide this from you, but because most conversations at the time a prescription is written are short. They cover the dose, the purpose, maybe 1 or 2 common side effects, and then the appointment moves on. What often does not get explained is what happens when amlodipine meets a breakfast habit, a missed stretch of tablets, a glass of alcohol, a pain reliever from the kitchen drawer, or another medicine that seems completely unrelated to blood pressure. Individually, none of these sound dramatic. That is exactly why they matter. Amlodipine is one of the most commonly prescribed medicines for high blood pressure and angina. It belongs to a group called calcium channel blockers. In simple terms, it helps relax and widen blood vessels so blood can move through them more easily and the heart does not have to pump against as much resistance. It is widely used, generally effective, and for many people, well tolerated. But well tolerated does not mean needs no attention, because there are predictable ways people accidentally make amlodipine harder to tolerate, less effective, or more likely to cause side effects. My name is Dr. Clara Hoffman. Before we go any further, do not stop, reduce, or change your amlodipine on the basis of this video alone. This is information to discuss with your own clinician or pharmacist, not a substitute for your medical care. Official patient guidance is very clear on this point. Do not stop taking amlodipine unless your doctor tells you to. In the next few minutes, I am going to walk you through 5 things to avoid, why each one matters, and what to do instead. Stay with me all the way to number 5, because the 5th one is the mistake I see overlooked most often, and it involves a combination many people are taking every single day without realizing it deserves a second look. I want to tell you about a patient I will call Martin. Martin was 68, recently retired, practical, disciplined, the kind of man who almost never missed an appointment and almost never complained. He had been taking amlodipine for months and assumed that because it was a common medication, there was not much to think about. Then, over a short stretch of time, several very ordinary things started overlapping. A breakfast habit, a few missed tablets, pain medication for his back, and a side effect he decided to tolerate quietly. By the time we spoke, the medication itself was not the main problem. The problem was everything around it. Here are the 5 things. Thing number 1, grapefruit and grapefruit juice. This surprises people because grapefruit looks harmless. It is fruit. It feels healthy. It does not feel like something you would mention when talking about blood pressure medication. But some patient guidance specifically advises avoiding grapefruit and grapefruit juice while taking amlodipine because it can increase the chance of side effects. And the reason this catches people off guard is simple. They do not think of food as something that can change how a medicine feels in the body. If your medication is already capable of causing dizziness, flushing, headache, or ankle swelling, the last thing you want is anything that may push those effects in the wrong direction. Common amlodipine side effects include swelling of the ankles or legs, dizziness, lightheadedness, flushing, tiredness, and palpitations. So what should you do instead? If you take amlodipine, the safer move is simple. Skip grapefruit and grapefruit juice, and if it is a regular part of your routine, mention it to your pharmacist the next time you pick up your prescription. NHS, that is the food issue. The second issue is not something you eat. It is something people do because they think they are being sensible. Thing number 2, stopping it, pausing it, or letting missed doses pile up. This is where many people make a quiet decision at home. They feel okay, or they notice a side effect, or they run low and think, I will sort it out in a few days. And because amlodipine is not the kind of medication that causes instant withdrawal symptoms, the pause does not feel urgent. That is what makes it deceptive. Amlodipine works best when it is taken consistently. It is meant to control blood pressure over time, not just on the days you happen to remember it. Patient guidance says to keep taking it even if you feel well and not to stop without speaking to your doctor. If you miss one dose, the standard advice is not to double up. Depending on the guidance source, You either take it when you remember unless it is close to the next dose, or skip it and resume your regular schedule. What matters more than the occasional single missed tablet is the pattern. Several missed doses in a row, running out, deciding to stop until the next appointment, treating a blood pressure medicine like something optional for a week, that is when control starts slipping. And while a major review notes that after stopping amlodipine, blood pressure usually returns to baseline over about a week without dangerous rebound spikes, that does not make self-stopping a good idea. It means the pressure you were treating can quietly come back. If you take amlodipine for angina, symptoms can worsen as well. PMC. What should you do instead? Do not improvise. If you missed a dose, follow the instructions you were given. If you missed several, call your doctor's office or pharmacist. If you want to stop because of a side effect, do not turn that into a private experiment. Talk to someone before the gap becomes a week. Martin did not think of it as stopping. He thought of it as being off schedule for a bit. That phrasing sounds small. The effect on blood pressure often is not. Now, the third thing is one people rarely connect to amlodipine at all. Thing number 3, drinking more alcohol than you think you can get away with. A lot of people assume the issue with alcohol is only about the liver or only about medications that cause drowsiness. But with amlodipine, the concern is simpler than that. Amlodipine lowers blood pressure by relaxing blood vessels. Alcohol can add to that effect and increase the risk of low blood pressure, dizziness, and feeling faint. NHS advice is to try to limit how much alcohol you drink while taking amlodipine for exactly this reason. The problem is not always obvious at the moment it happens. Sometimes it is not, I drank and immediately passed out. Sometimes it is, you stand up too quickly. You feel unsteady walking to the bathroom at night. You feel hotter, more flushed, more lightheaded than usual. You blame age, fatigue, or not eating enough. And you never connect it to the fact that alcohol and a blood pressure medicine were both pushing in the same direction. What should you do instead? Moderation matters here. If you already know amlodipine makes you dizzy or sleepy, be even more cautious with alcohol. And if you notice a repeated pattern of lightheadedness after drinking, that is worth bringing up, not ignoring. Now, the fourth thing is sitting in medicine cabinets everywhere, and many people start taking it without mentioning it to anyone. Thing number 4, regular ibuprofen or naproxen without checking first. This is one of the most common everyday medication mistakes. A sore knee, back pain, arthritis, a headache that keeps coming back. So you reach for ibuprofen or naproxen because they are over-the-counter and familiar. The problem is that NSAIDs can raise blood pressure and blunt the effect of many blood pressure medicines. That interaction has been documented broadly, and while amlodipine appears less effective than some other blood pressure medications, it is not completely outside the conversation. That detail matters, because a person can think it is only a painkiller, and then wonder weeks later why their blood pressure readings are drifting upward. Not because the amlodipine suddenly stopped working, but because something was quietly pushing against it. What should you do instead? If you need occasional pain relief, ask your pharmacist what is most appropriate for you, rather than assuming every over-the-counter option is neutral. In one controlled trial, acetaminophen had much less effect on blood pressure than ibuprofen or piroxicam. And if you need pain relief regularly, especially for arthritis or chronic pain, that deserves a real medication review. Do not build a daily routine around ibuprofen and then wait for the blood pressure problem to show up later. Martin had done exactly that. Not because he was careless, because he was trying to function. That is what makes these interactions so common. They do not come from recklessness, they come from ordinary life. Now, the fifth thing is the one I most want people on amlodipine to hear, because it involves a combination that often goes unmentioned. Thing number 5, taking simvastatin above the recommended limit with amlodipine. This is the one many people have never heard about. Amlodipine and simvastatin are both common medications, one for blood pressure, one for cholesterol. It is very easy for someone to be on both and assume the combination is routine and therefore needs no review. but official prescribing information says that when simvastatin is used with amlodipine, the simvastatin dose should not exceed 20 milligrams per day because amlodipine increases simvastatin exposure. UK drug safety guidance says the same thing clearly. The maximum recommended dose of simvastatin with amlodipine is 20 milligrams daily. Why does that matter? Because once exposure to simvastatin goes up, the risk of muscle-related side effects goes up with it. And here is why this one gets missed. People do not always think of cholesterol medication as something that needs to be reviewed when the blood pressure prescription changes. They are filed in different mental drawers, but your body does not organize them that way. What should you do instead? If you take both amlodipine and simvastatin, check the simvastatin dose. If it is more than 20 milligrams, do not panic and do not change it on your own. Call your pharmacy or prescribing clinician and ask them to review the combination. This was not Martin's issue. But it is common enough that if you are on amlodipine, it is one of the first medication pair questions worth asking. So let's step back. 5 things. A fruit juice that looks harmless. A few missed tablets that do not feel urgent. A little more alcohol than your body handles well on this medication. A pain reliever taken often enough to start pushing blood pressure the wrong way, and a cholesterol medicine combination that may need a dose limit review. None of these feel dramatic in the moment. That is the pattern. The most important problems with amlodipine are often not dramatic at the start. They are quiet, they look ordinary, they sound temporary, they feel too small to mention. And then, weeks later, the person is sitting there wondering why the dizziness is worse, why the ankles are swelling, why the readings are higher, or why their medication suddenly seems different from before. Martin's real mistake was not one huge decision. It was assuming that small decisions around a common medication did not matter. They do. If you take amlodipine, here is the practical takeaway. Avoid grapefruit. Do not let missed doses turn into a pattern. Be cautious with alcohol. Do not make regular NSAID use a silent habit. And if simvastatin is part of your routine too, make sure the dose has actually been reviewed in the context of amlodipine. One final point. If you are having side effects like swollen ankles, dizziness, or palpitations, do not just put up with them quietly. These are recognized side effects of amlodipine, and they are exactly the kind of thing your clinician needs to hear about so the plan can be adjusted safely. Which of these 5 was new to you? Tell me in the comments. And if someone in your family takes amlodipine and thinks of it as just a basic blood pressure tablet, send this to them. Because the biggest problems with common medicines are often caused by common habits. This is Dr. Clara Hoffman. 5 ordinary things, 1 very common medication. And now you know what to watch for.